Are we ready over there? Thank you. Let's go ahead and bring to order our Washington County District Health Board of Health for Thursday, March 23rd. And if we can have a determination of quorum.
Chair Dare,
Here.
Vice Chair Reese,
Here.
Commissioner Garcia,
Here.
Michael G. Brown,
Here.
Dr. Denko,
Here.
John Clacking will be absent, and John Novak, DMD. Chair, we have a quorum, and I'm your recording secretary.
Thank you so much. Would you all stand, and we're going to have the Pledge of Allegiance. And if Vice Chair Reese would mind leading the way, sir.
Happy to do so. Please join me in honoring our flag. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. How many times a week do you get to do that, right?
Not enough.
I agree. Oh, we're on to 3, approval of the agenda. Do we have anybody that has any questions on it or would like a motion?
So moved.
I have a first and a second. And don't forget, we're using our screens to vote. First is Vice Chair Reese. Second is John Novak. And all in favor?
Aye.
Any opposed? Passes unanimously. And we are on to recognitions. Senor Kevin Dick.
Thank you, Chairman Dare. I'd like to begin with new hires to recognize Pia Bronstein, who is a new public health nurse in CCHS, but I don't believe she's, she is here. Okay, perfect. Yeah, Ms. Lotritz, could I please ask you to make an introduction?
Come on down. You're the next contestant on.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services for the record. I would like to introduce Pia Bronstein. She is our new public health nurse for the immunization program. Pia spent many years in acute nursing care, and she's looking forward to exploring this new role in public health, and we are excited for her to join our team. So welcome, Pia.
Thank you. Happy to be here.
Thank you so much. Welcome. Please stick around. We take a picture of you now, and then when you retire, and we think you look younger when you're done. That's how much you're going to love this job.
All right. We've got a couple of other new hires on the agenda, Alexander Messenger-Patton and Ryan Vogler. However, they don't actually start until Monday, so we're going to bring these back on the agenda next month because Mr. Vega would like to introduce them to us.
Oh.
Next, we have a promotion that I'm very excited about, and that's Erin Dixon. And where is Erin? Erin, who is currently our Environmental Health Services Division Director, is being promoted to Deputy District Health Officer, which is a new position for the Health District. We had an open national recruitment for this position. And Ms. Dixon rose to the top of our candidate pool. We had some very good candidates for this position. I want to thank Dave Solaro, the Assistant County Manager, for participating with me on the interview panel. And just wanted to note Ms. Dixon has 21 years of experience with the Health District, working in the Community and Clinical Health Services Division in Administrative Health Services Office, and most recently as Division Director of Environmental Health Services. And as this is a new position, I also wanted to talk with the board a little bit about what Erin and I are in agreement of at this point as far as the responsibilities for this position. But we, as I've said to Erin, this is kind of a human experiment because it's a brand new thing with the Health District, and we may make adjustments as we go along. But she'll be responsible for operational aspects of CCHS, EHS, air quality management, and Administrative Health Services. And she'll also be working around legislative and policy issues, and we have many of those that come up, particularly this time if you're in the legislature, around air quality management, environmental health, and community and clinical health services. And while I'll be continuing to work closely with Ms. Dodson on our government affairs, she will be a direct report to Ms. Dixon for some span of control issues. She'll also be responsible for supervision, of course, of those division directors and Ms. Dodson, but also HR issues that rise up through those divisions. She'll be working on our business and industry and governmental relations related to those divisions' operations. And also she will be our lead on space issues as we are continuing to struggle with the number of staff that we have at the health district and the space that we have available, but also a huge project, which is the $10 million that we're receiving through ARPA for a new building to replace our TB clinic and provide some additional space for our staff. So that's the extensive list that we have for Ms. Dixon. And she is continuing to act as the Environmental Health Services Division Director until we fill that position. So I'm very pleased to have Ms. Dixon coming on board, and as I've told her and others at the Health District, I do hope to be taking some vacation time with some of this help. So.
Well, I want to say, too, we've been, I mean, we all approved this moving forward to see this new, so part of it has to do with succession planning as well, making sure that somebody else is trained up and knows what the heck's going on, and it's not all on one, and then, so there's a splitting of that, and no matter what happens in the future, we at least have that information that's out there. So I think it's a very wise move, and I think they made a very wise choice, so. Transfers.
Yes, I'd like to.
Hold on, we didn't give her a hand. Come on, come on.
All right, next I'd like to recognize Gail Erickson. And Gail, if you could wave to us. Very sorry to be losing Gail, who's been a program coordinator here, who is moving over to the Human Services Agency as an administrative assistant too. And I just wanted to comment that Gail joined us during COVID-19 and demonstrated her capabilities and abilities very rapidly. She took over running our ops when Jim English stepped down from that role, and has done a tremendous job for us. But also I understand her desire to have a position that's not on COVID grant funding that we know is going to be going away eventually. So congratulations to Ms. Erickson. And also wanted to recognize Marissa McCune, who's not able to join us today, I don't believe, who has moved from Administrative Secretary at Air Quality Management to a library assistant at the library. Next, we have a couple of county health heroes to recognize. I want to recognize Sheila McCoy. And Sheila, thank you for your efforts and being recognized for by your peers for demonstrating our values at the Health District. And also wanted to recognize Kayla Solario. Both Sheila and Kayla are with Community and Clinical Health Services Division. Kayla is not able to join us today, but very much appreciate their efforts and their recognitions. And lastly, I want to make special recognition to our Health Heroes Committee. So our Health Heroes program has been developed by a committee of our staff, and they've done a fantastic job. It's a new program initiated over the past year, and they have established some bylaws and a structure for them to be able to function in the future, but some of our members are going to be stepping down, and we're going to be having some new members join the committee. So I wanted to recognize the committee. I want to begin with Kelsey Atkin, unfortunately, she's not able to join us today. We have a number of staff that are out, and it's spring break time for schools, so that happens. But Kelsey Atkin, who is with our WIC program in CCHS, has chaired this committee and has done a tremendous job of developing our program and moving everything forward. And we have Lisa Sheretz is here, who's secretary for the committee. Gail Erickson, also a co-secretary for the committee. And Craig Peterson, who's not here, is the treasurer for the committee. In addition, it includes Susie Valdesman. Susie, raise your hand. Yara Diavola. Yara here, there she is in the back behind the glass partition. Kristen Palmer, Kristen's not here. She's on vacation, that's what's going on. Rachel Cord is not able to join us today. Candace Brown with Air Quality. Marissa McCune, who, as I mentioned, has gone over to libraries. Danica Williams with EPHP, there she is. Heather Burrs with EHS, and Michael Toohey with EHS. So I want to thank all of you for the great effort you've put in over this past year and a great program that you've developed for us. So thank you.
On behalf of the board, I also want to thank you. You know, these things are up and beyond your job. We know that. You don't have to go be nice to people like that if you don't want to, and you did. And you stepped out and you even organized something that will last longer than even you being there, which says a lot about the staff that we have. So just big kudos to you, and thank you. We appreciate it. I think we have pictures now? Or do you want to do the proclamation first?
I can do the proclamation first,
Okay.
and then we'll be all organized for pictures.
Hold on, we give them a hand, all of them. There you go.
I'm going to put on my glasses. Susie made one with big print for me, but I left it up there. So today's proclamation is for National Public Health Week. Whereas since 1995, National Public Health Week has educated the public, policymakers, and public health professionals about issues important to improving the public's health. And whereas the theme for 2023 is centering and celebrating cultures in health, which is in line with the Health District's commitment to invest in equitable health opportunities for everyone in Washoe County, especially for those who are underserved. And whereas a person's health status can differ drastically by zip code due to differences in the built environment, environmental quality, community context, access to healthy food, access to education, and access to health care. And whereas public health professionals help communities prevent, prepare for, withstand, and recover from the impact of a full range of health threats, including disease outbreaks such as COVID-19, pandemic, measles, natural disasters, and disasters caused by human activity. And whereas public health action, together with scientific and technological advances, has played a major role in reducing and in some cases eliminating the spread of infectious disease and in establishing today's disease surveillance and control systems. And whereas preventable risk factors such as physical inactivity, poor nutrition, tobacco use, and excessive alcohol use are leading causes of chronic disease, and 6 in 10 U.S. adults have a chronic disease and 4 in 10 have 2 or more, and chronic diseases cause 7 of every 10 deaths annually in the United States. And whereas the COVID-19 pandemic has illuminated and exacerbated racial and ethnic health inequities, whereas life expectancy has more than doubled over the last 200 years, primarily due to public health measures, and whereas public health recommendations and data empower the general public with information and options on how to live healthy lives, prevent chronic injury and disease, and use preventive care to improve health outcomes. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the week of April 3rd through 9th, 2023 as National Public Health Week. Signed, Christopher Dare, Chairman of the Washoe County District Board of Health. And I'd like to accept this along with all of the staff of the Health District and on behalf of the District Board of Health.
Thank you. And I do want to also let all the staff know on the 9th, on the final Friday that morning, we're going to be serving coffee on the 7th. Did I say the 9th? I'm sorry, I did say that out loud. It's the 7th on the Friday morning from 8 to 9 over in A or B, one of those, both of them. If you come on over between 8 and 9 a.m., we're going to all be there, most of us that can. And even if we can't be there, all our hearts are there. But I'll be there, and we'll be serving Lighthouse coffee. Anybody ever go to Lighthouse? We'll be serving some Lighthouse coffee there and other stuff, so a little breakfast to say thank you. And please stop by. We just want to celebrate you and want you to know that it really is something. In a community like ours, without you, we'd be in trouble. So we really appreciate your guys' sacrifice. Cool.
All right. I think we're ready for pictures.
Come on down.
Oh, we got to vote on this one, I guess, first.
I'm sorry, say again?
I guess we have to vote on the proclamation.
Okay,
first.
yes, I'm sorry.
Second.
We have a first and we have a second. Chikich, Brown, Novak. All in favor?
Aye.
Any opposed? It passes unanimously. Good job, everybody. And let's all go down.
All right, why don't we have all the health heroes come up, and we'll get your picture, and you can have the proclamation picture also. Well, the committee and the heroes, how about that? But I meant the committee, you're right. We can go through, oh, you're taking the picture.
We're gonna make it work. Okay, here we go. And 3, 2, 1. Got it. Thank you.
have your badge? Oh.
I'm running. I'm gonna do the 10K soon. You'll watch. Awesome. A little training to do.
Doesn't open that one.
Okay, we are on now to public comment. I believe we have one, I hear.
We have two public comment. We have Mr. Ryan Kantz, followed by Mr. Gary Gordon.
Please come join us.
Good afternoon. My name is Ryan Kautz. I moved to Reno 12 years ago from California. I also brought my company. I'm an environmental consultant and civil contractor in 4 western states, California, Nevada, Oregon, Washington. I am also a CEM, a certified environmental manager in the state of Nevada, and I'm also a hazmat specialist and incident commander with the California State Fire Marshal. Moved to Reno and then actually started a second business here, Whispering Road Investments. It is a real estate development company. We bought 7 acres of commercially zoned property in Verdi. It's within city limits of Reno, and are currently developing it as a business park. I have taken out bank loans, invested heavily in the millions of dollars in this project. We've been super proactive in working with the different permitting agencies, whether that be City of Reno, Washoe County Health, NDEP. City of Reno and NDEP have been extremely helpful, customer service, fast on their permits. I can't say the same of any of those things with this agency here. I have several documents I would like to submit for the record. Many of my permits have had holds, some of them up to a year. They're not typical holds. It is vendettas by certain people within this department. In these documents are several emails detailing that, like a history of bias, specifically individuals. And we are requesting that a third-party reviewer take over these permit reviews, which makes most sense anyway, because the majority of the permits are actually issued at the state level. Because of my commercial zoning, it is not a Washoe County Health District function. Those permits are through NDEP anyway. So it is mind-boggling why certain individuals in Washoe County Health supervisors spend so much of their time scrutinizing my permits that are not issued or regulated by this agency. And I'm going to pass off to Garrett Gordon. And where do I submit paper? The only other thing is I would like to invite any and all board members to reach out to me, and I would love to tour you through the project and show you first-handedly what it is we're working on.
Thank you, Mr. Kantz. Appreciate it. Yeah, if you just give those over there to her, that'd be fantastic. She'll make copies for each of us.
Mr. Chairman, thank you.
Yes,
For the record, Garrett Gordon, partner at Lewis & Roca, today representing Ryan Kautz and Whispering Road Investments. This is a first for me, public comment in regards to some really serious concerns we have. The building permits for this self-sufficient and environmentally sustainable commercial project have been routinely approved by Reno in a matter of months or even weeks with some departments. Despite City of Reno approvals, my client's permits have been continued to be placed on hold by the Health District for almost a year. I've been representing developers in Reno for 17 years before City of Reno, City of Sparks, Washoe County, and never seen anything like this. There's actually one permit that's pending today that's been on hold since April of 2022, a year, for a simple office building that has been on hold for no other reason than, as Ryan indicated, he believes biased because Ryan, in his frustration, filed a public records request to understand why he was being treated differently. And since then, it's been hold after hold after hold. Regarding the holds, weeks and months go by with no health responses. Health gives comments as justification for the hold, which literally start out with 3 bullet points. And then months later, there'll be another paragraph. Then a month later, another paragraph. And a month later, another paragraph. It's like we're in this rabbit hole that we can't get out to get a permit, and it's just not right, and literally causing Ryan and his company hundreds of thousands of dollars. In addition, Health has refused to take action, blaming other agencies. For example, the Nevada Department of Environmental Protection, NDEP, certainly a justifiable agency to review any environmental concerns. However, they visited the site twice and said, I quote, I was standing in the room, there are no red flags here, and emailed Health weeks ago, if not months ago, saying, issue the permit. We still don't have a permit from the #1 state environmental agency saying there's no problems. Why is Health still holding our permit? The Health process is broken for this process. I will say that we have made progress in the last few days, but this comes at considerable expense. My client has literally had to hire 3 attorneys over the last 2 years to pull permits for a project that City of Reno has approved and that NDP has signed off on. This is a rabbit hole that he can't get out of, and it's costing him so much money, jobs, interest, and almost lost Squaw Valley, now known as Palisades, as a tenant, which would be wonderful who wants to invest in Verdi. So as a result, one other thing, moreover, now that we're making a little progress, it's only because I believe we have to copy between 10 and 15 people on every email to make sure we get a timely response. As a result, we simply are asking for a third-party reviewer. Seems very fair. Both sides can't get along. Both sides can't pull this permit. We would simply like this permit that's been on hold for a year and any future permits to go to an unbiased third-party reviewer so we can get Ryan's building built, get the jobs created, get the property taxes we need, and move this project forward. Thank you, Mr. Chairman.
Thank you, Gary. Any other public comment? Thank you so much. Okay, we do move on to our COVID-19 flu RSV update and information. And for the record, I think this might be our last one for a little while, right? Is that what we're talking about?
Yes, that's correct, Mr. Chairman. I'm going to run through for you where we're at now with all of those, but I anticipate this will be the last time I agendize this for the Board of Health, unless things change quite a bit, because we seem to be in sort of a continuing low level of incidents that we're having right now. As far as COVID-19, our community impact level is low. Our 7-day moving average of new cases is at just over 26 new cases a day. And we have 172 cases that were reported over the week that ended on March 20th. As far as hospitalizations, we've got 18 confirmed and suspected COVID-19 hospitalizations. That's the same we had last month when I reported to you. And that's just 1.7% of our staffed inpatient beds that are being utilized for COVID-19 patients. Our wastewater samples had a slight increase the week of March 6th through 12th, but they remain at low levels. I think the only thing that's really changing is our subvariants. And we now have XBB 1.5. That's our predominant lineage, making up 74% of our sequence samples, but we're not really seeing impacts from the lineages and subvariants changing. Did want to mention there's a new study out in the JAMA Internal Medicine today, or a couple of studies that show the importance of vaccination and Paxlovid for avoiding long COVID. 1 in 5 COVID-19 survivors aged 18 to 64, and 1 in 4 survivors 65 and older have ongoing health issues that may be attributed to COVID-19. And the study found that those who had been vaccinated against COVID-19 had almost half the risk of long COVID than those that were not vaccinated. The other study found that those that had used the antiviral Paxlovid within 5 days of a positive COVID-19 diagnosis had a 26% lower risk of long COVID and a 47% lower risk of death, 24% lower risk of hospitalization. So these results on the Paxlovid are for adults that were over 60 or those with underlying health conditions, because those are the individuals that were eligible to receive the Paxlovid under the emergency use authorization. So these studies really further demonstrate the importance of people getting vaccinated for COVID-19 and remaining up to date on their boosters, as well as for those that are eligible, seeking the Paxlovid treatment if they are tested positive with COVID-19. I wanted to mention that we continue to have mask requirements in our clinical areas, and that's due to CDC recommendations that face coverings be worn in clinical settings in areas that are designated as high COVID-19 transmission. And that high COVID-19 transmission designation, that's a different risk system than the CDC community level that's at low. And that transmission level for us is currently at high, and that's because of our test positivity being above 10%. However, the CDC has not made any adjustment to this positivity risk threshold since before the at-home tests became available. And so the value of this measure is questionable since our reported cases are not representative of testing that's happening across our community with people that are using the at-home tests. So the state rescinded the requirement for hospitals to follow the CDC face covering guidance in January. Our hospitals here in Washoe County are continuing to follow that guidance at this point, but we're evaluating whether to continue this practice in our clinical areas, and I'll keep the board informed if we make changes in that regard. As far as flu goes, Nevada remains at an influenza activity level of minimal. Our county influenza-like illness percentage reported by our Sentinel providers decreased from 1.1% of patients seen to 0.8% over the past weeks, and we've had no hospitalizations reported for the week ending March 11th and no new deaths reported. For RSV disease, RSV is also bumping along at minimal levels. We've had 6 cases reported for the week ending March 18th. And so we're through the surge that we had earlier on in the season, and it's good to see these numbers continuing low. And I think everybody will be pleased that I no longer need to report on this as a monthly basis. So,
It is good.
thank you.
Ms. Dinko, do you have anything to add? The one thing I would ask, and I say this because you're in it every day, that if there is ever anything that you are seeing that you're saying, hey, we should talk about because we want to be the place where we educate, we show, whatever, please feel free to call us. We'll get it on the agenda, and we can change what we just did. So, thank you. And the other thing I would just say to that as well, when you talk about vaccinations, what doesn't have to answer now, but I look forward to hearing back some conversation regarding how they want to. I've heard everything from mixing flu and COVID together. I mean, I heard some different things. So just as that thing unfolds, if you can keep us, I'm really interested to see how we're going to approach the education of that next step.
All right, I will, and you just reminded me, we did do a homebound vaccination yesterday at the Northern Nevada Veterans Home, and got 25 individuals vaccinated over there.
Very good.
Chair, we have Vice Chair Reese on your tablet.
Yes.
Asking to speak.
Thank you,
Thank you.
Madam Clerk and Mr. Chair. I think, first, Mr. Dick, thank you for your leadership through a very difficult period. I wish I could say I believed it was entirely over and the difficulty had passed. I think the material you presented is encouraging. I think we should all take comfort in that, but I think it's also a moment to reflect on the fact that we've had more than 1 million deaths in the United States, potentially underreported in the 3 million, as far as I can tell from the literature that suggests that underreporting has occurred, and more than 103 reported cases of COVID positive. And so just, I would hate to have it lost in the moment where we were talking about, numbers, that we just pause to remember that that's thousands and thousands of millions of lives lost. So thank you again for the District Board of Health standing in the gap for this community and for all the people who have made it so that we had fewer deaths than we would have otherwise had. The people in this department have my entire thanks for how they comported themselves during the pandemic and today.
I agree, and I'd even add to that the community of volunteers that we saw volunteerism step up in our community, like many others, I'm sure. But I don't know the other communities, so I think we're better. So we'll just talk about us. We had incredible. So, Mr. Novak, you want to say
Okay. The one thing I want to bring up is to make sure that we go out and tell everybody in the the public and our circle of friends make sure that they get the bivalent vaccine. Just the first two are not going to be enough. The bivalent seems to be carrying over a lot of these new variants pretty nicely. But come May 11th, things could be making a drastic change. So right now, it's free, it's available. You can contact the health department or your pharmacy, whoever, but please make sure you get the bivalent.
Yeah, I do remember it's been winter for like 6 months. Everyone's been in their house. So come May, everyone's going outside, hanging out with you. So thank you so much. Okay, we are moving on to consent items. Would anybody want to pull anything before we look for an approval? If not, can I have a motion?
Move to approve the consent items as posted.
We have first by Reese,
Second?
second Tango, and any other discussion? All in favor?
Aye.
Aye.
Any opposed? That passes unanimously. Let's continue. We are on to 9 Regional Emergency Medical Services Authority, and Barry Duplantis.
Good afternoon, Chairman Dare and members of the board. I'm Barry Duplantis, CEO and President of REMSA Health for the record. I understand that you have been provided a copy of REMSA Health's February 2023 report. I do want to note 2 things about the report. The EMS survey, which is customarily part of the report, is not included. There was a technological glitch with the EMS survey company. We just received those results yesterday, so we're in the process of doing the patient follow-ups. So we will have that to report to you next time we report. Additionally, an additional thing I'd like to point out on the report is that when you look on page 1 and you look at the numbers of patients that we've billed per month, you'll see that there's a little lag there because as we've talked about this in the past, we converted to a new system called Image Trend, and as a result of that, it's caused us to be a little behind. So we're still in the process of catching up. So as you look at the months of December, January, February, you'll see them a little light, but they will progressively increase as we catch up on our billing. But having said that, the company is on an accrual basis of accounting, so we still close our books on a monthly basis based on the accrual method. With regard to our compliance for the month of February and for the year to date, I'm pleased and proud to report that we were 91% with P1 calls in Zone A, and 90% in zones B, C, and D for P1 calls. An additional point I'd like to just continue to emphasize to continue to raise the sensitivity. In the month of February, although it was a short month, we continue to respond to about 263 calls per day where we actually send out an ambulance. Of that, we ended up transporting about 163, so 100 of those calls per day are very low acuity. It's consistent, even though February is a shorter month, the calls per day is consistent with January. So as we talk about community health, I want to continue to emphasize that increasingly and consistently people use 911 as access to health care. And I think that that's kind of a symptom as to why we end up with a fair number of low acuity calls for which we respond to and they don't require ambulances. The additional thing I would like to ask of you is, in the spirit of the regionalization project that we are working on, with your permission, I'd like to come forward next month with a review of our dispatch operation to help you understand a little bit more about what EMD, Emergency Medical Dispatch, is and what it means in this community. Because in our franchise agreement, as articulated and decided decades ago, REMSA has a very rigorous and robust EMD process. And it would be our honor to help share with you what that is, what it means, and why this community is awesome because of it. That said, I'm happy to address any additional questions that you may have.
Any questions from the board or comments? I have two quick ones. One is, I have asked also, and this will be something that's coming, I don't think it's today, EMD accreditation. One of the things that I've asked for us to understand better, that's one of the things that we get to help keep in place, or at least require. And so with that said, I like to understand for myself more of what that means, but then also what's the benefits of that for our region. And so I think I know some of it, but I want to make sure I understand that, especially as we all, as a region, look at our what we're doing with our emergency dispatch. Second thing is, on this number 2007-92 with no transmits resulted, is there a way to know, some of this might have been because you sent people to an online help nurse. Some of it is because they should never have called you in the first place. And I say that, it's good that they call somebody, but we've done a lot of work of trying to get people to think differently. It'd be nice to know if there's some measure to say, are we moving the right direction or not at all? Because if we're not moving the right direction at all, that people still only call, you mentioned it, but are we seeing the numbers just grow? Are we seeing them drop? Are we just staying even? Is there something new we can do to try to inform people a better way to call? I'm just saying that we really would save us all a lot of heartache if we could find a better way to educate those who have needs.
Well, let me comment that the numbers that I reported to you have been steady for some time.
Okay.
It's not a new element, but I do believe, and let me just candidly comment, as a company involved in EMD, we compare ourselves and have conversations with folks around the world. And what we experience here in the U.S. and even in Reno, Nevada, with regard to EMD is consistent. People around the world abuse emergency dispatch numbers. That's true in Australia. It's true in the UK, as we learned just last week.
Gotcha. Thank you.
Mr. Chair.
Yes, sir.
Thank you so much, Mr. Duplantis. I appreciate always the updates. I continue to believe that I'm not certain that the updates are that helpful to me other than having them transmitted to me for my review. That's something that we can work on, the chair and I. But I do want to sort of have a conversation with you about the City of Reno's decision to have a single paramedic program. So we have rolled out 6 persons, and we have the apparatus to now help our fire department respond to some of the calls for service that they encounter, which allows us then to decrease the wear and tear in our rigs and the calls for service that we're encountering. So would you anticipate, and as I understand it, you've been a part of those conversations and have had a gracious spirit about it. So thank you for that. But as you sort of think about and survey the world, and as we move forward at the City of Reno with that program, will that decrease your calls for service? Will it reduce the number of calls that you have to respond to? How do you see REMS's role in that?
REMS's role will be unaffected largely by that. Where the impact is to the community, and with regard to the situation that you've described, I share the same beliefs with the fire chiefs, not just of Reno, but the other jurisdictions as well, where we really want to preserve our fire assets for fires and not roll them unnecessarily to help maybe do a lift assist when a patient has fallen in a skilled nursing facility. That said, it makes sense to send something other than a fire truck to do something like a lift assist, but in no way does it even require an ambulance if you don't have the authority to transport. You could do the same thing with a single resource in an economy car, for that matter, where you go and you do the lift assist and you've accomplished everything at an economical basis. So we're supportive of protecting the precious resources of the community, but we always have to look at what is really the appropriate resource to allocate to the call requests.
Chair, we have Mr. Zeb Nomura on Zoom with his hand up. I'm not sure if he's trying to make public comment for this specific item.
Okay. Do you want to just see if he'd like?
Oh.
Mr. Nomura.
Yeah, sorry guys, that was an accident with my phone.
Well, Zeb, I know you, so I'm coming after you, brother.
Okay, that sounds good.
How you doing? Thank you.
Doing good.
Have a good day.
You too.
It looks like maybe Mr. DeAndre Burleson is raising his hand. No? Okay, no.
Okay. So with that said, can I have a motion to accept?
Motion to accept report is provided.
So
Second.
I have a first and a second. Any other discussion? I see none, and all in favor?
Aye.
Any opposed? And I believe that passes unanimously. Thank you very much, Mr. Gladys. And next, we do have Alexia Jobson coming up and going to share about the update of REMSA Health's public relational during the February 2023.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for the record. And you have for your review the Public Relations report for February. I'm available to answer any questions that you may have.
Good report.
Well, I do want to just tell you, this last season I know has been difficult for everybody, but you've been put in a very difficult position, and you guys did an amazing job in our community. And with our hearts go to you, but also there's a lot of skill behind what happens when we grieve and when we walk through. And the only thing worse than difficult things happen is when bad communication on top of it. And so you guys did a great job.
Thank you. I will share that with the team. Thank you.
And we don't need to accept that. We're good.
Thank you.
Thank you. And we're on to update of the Washoe County Health District fiscal year 24 budget, including meetings with the manager of Reno Sparks in Washoe County, Kevin Dick.
Sorry, I believe.
Did I miss one?
Yeah.
Oh, I'm sorry. Oh, I'm sorry. Sabrina, that was not personal. Is that why you were staring me down? We have 9C, presentation, discussion, and possible approval of the Regional Emergency Medical Services Authority with Sabrina Brissell. Thank you so much.
Thank you. Good
Forgive me.
afternoon, Chair Darren, members of the board. I'm here today to discuss the information you have in front of you specific to the staff report, as well as the compliance report and the compliance checklist for the fiscal year of 2022, specific to REMSA and the franchise agreement and obligations. REMSA was found to be substantially compliant. The areas of non-compliance should be reasonably familiar to the board, given that the permission to inform REMSA of the compliance, the non-compliance, as well as the request for corrective action and continual updating of that corrective action process was approved by the District Board of Health. In the staff report, it outlines the actions and opportunities specific to that act of non-compliance and the resulting corrective actions and progress on that. As you heard in Barry's operations report, non-compliance or corrective action and non-compliance follow-up has been completed in each of the months following that notification. And the only other areas found to be non-compliant were the ones associated with that non-compliance, and it was just providing the information and follow-up, and that there were no actions in addition taken by the board in regards to the franchise and continuation of services. There was no halt to services or any actions taken through that. So the staff report outlines a few of those opportunities. The compliance report breaks down each section of each franchise article, and then the compliance checklist does that in a graph visual form. I'm happy to take any questions.
Any questions? With that said, I don't either, but thank you for the update. Appreciate it. Would someone send a motion?
Mr. Chair, I move to approve the Regional Emergency Medical Services Authority franchise compliance report for the period of 7/1/2021 through 6/30/2022, fiscal year 22.
We have a first.
Second.
We have a second. And any other discussion? All in favor?
Aye.
Any opposed? And I believe that passes unanimously as well. Thank you so much. Keep
Thank
up the good
you.
work. And now we are on to 10, the update on the Washoe County Health District fiscal year 24 budget.
This ought to be good.
All right, thank you, Chairman. I want to begin with the meeting that was held on March 1st as it's a condition of our interlocal agreement that I meet annually with the city and county managers to go over the health district budget with them. And so that meeting occurred. And as far as comments that were made during the meeting, they were fairly minimal. Manager Brown inquired as to how we were dealing with the Corn Ferry position classification and compensation review. And I had discussed that with the board last year, that we really didn't fully know the impacts of that. We were hoping to get more information, but we were told that it would have an impact of somewhere just under $1 million in the budget. Then Manager Kreutz from Sparks commented that it must be a little bit disconcerting to have $1 million in the budget that we had to still figure out, which I think is true. And then Manager Thornley from Reno inquired on our EHS staffing and whether we felt that the increase that we had of an additional RAHS and an OA3 in that program was sufficient for our needs with plan review. Ms. Dixon then discussed that with him and explained that with what we're doing with the transition from EHS being a generalist type program to specialists that are going to be focusing on the plan reviews, and with that additional RHS personnel, that we felt that was going to address that need moving forward. And that is the extent of the comments in regard to the budget during that meeting. What I have provided to the board today is an updated spreadsheet of the FY24 budget and the projections through FY27. That what we have done is incorporated $1 million in the budget, additional expenditure funding, because we still don't know fully and specifically what the impact of that classification and compensation study is going to be. We have that figure from the county budget office. There are some positions that the county has shared what they're proposing the new ranges be under from minimum to maximum salary for those positions, but they have not provided those ranges for administrative and clerical positions yet. And the positions that they have provided that information for have changed several times over the past month. So we're still kind of in a state of flux and understanding exactly what the impact is going to be, because those ranges alone don't tell the story of who's actually going to have a salary adjustment on August 14th, as the county has proposed to make this occur, or retroactively to occur, and who is just going to be in that range, and now maybe they have more headroom on what their further merit increase opportunities are. So we incorporated the $1 million, and it's distributed across salaries and wages, where we increased the expenditure budget by $687,906. The group insurance that increased by $77,085. The OPEB contribution, which is the contribution for retiree health plans, increased by $31,022. The retirement expenditures increased by $193,004, and our new the other employee benefits increased by that was retirement benefits, $193,104, and the other employee benefits, $10,883 increase, or a total of $1 million increase in our expenditures. So what that does change with the landscape when we incorporate looking at future COLA increases and 5% annual merit increases, just as a rough projection of what that additional impact in those expenditures this year may mean in the out years, is that our ending fund balance this year would be at 33% of the expenditures. Our ending fund balance next year would be at 32.2. I'm sorry, I said this year, I'm really talking FY24. FY25 would be 32.2%, FY26 at 17.9%, and then FY27 down to 1.7%. So guess the good news is it takes us down into the range that the board has traditionally looked at, that the county uses, of a desirable ending fund balance being between 10 and 17%. But that happens in FY '26, and then we go below that in FY '27. I also provided the board a table that I put together of historically what we have provided as our projections for ending fund balances in looking 3 years out versus what our ending fund balance actually was. And what the situation that we have historically is that our ending fund balance has always ended up being much larger than what we had projected the ending fund balances to be looking forward. And I think that's in large part is due to the fact that when we do our budgeting and we do these projections, they're all based on having salary and benefits for 100% of our staffing 365 days of that year. And the reality is we never are fully staffed, and we have new positions that go unfilled while we're in the recruitment process and those types of things. And so while the out-year projection does fall down to 1.7% with this current budget, I feel comfortable with that, knowing that it's not likely to actually fall down to those levels as quickly. And we have each year an opportunity to look at where we ended up with fund balance and an opportunity to make any corrections or shifts in our direction. So I'm looking for the board's approval of this adjusted budget for us to be able to work with the county in their budget process. The county manager is to present his recommended budget to the Board of County Commissioners on April 18th, which will be before we meet again. And it's very unclear when we're going to have more detailed information from Korn Ferry to actually build that into the budget in any more detailed way. So at this point, I think this is the best solution for us moving forward with the budget.
Okay, any discussion? So one of the things that we similarly do as a city, and I just only say that because we all have different jobs and different things, and those of us who do city as well, we look at this and we have make policy where things should lie, and we kind of have a general policy based on the county saying that 10 to 70%, which is very high. I mean, that's a nice ending fund balance. City of Sparks is at 6%, if that tells you a little bit of comparison. However, we're talking about our county health, and there's nothing wrong with that. But I'd say that gives us enough room to really adjust if necessary in the years to come. I would agree with that. Obviously, if anybody's watching this, some people only listen to the last thing you said. We do not believe 1.7% is enough to have an ending fund balance. However, in the projection of what we do, there's so many unknowns between, just cost of things, you name it, of what's coming. So I'm comfortable with that. But with that said, any other conversation? Okay. I'm looking for a motion.
So moved.
First.
Second.
Have a second. He keeps beating you just by a moment, so. Any other discussion? I see none. All in favor? Aye.
Aye.
Any opposed? That passes unanimously. Thank you. I know that our goal is usually to have everything tied up. I just make that aware. But the way that everything landed, timing with Korn Ferry and things, that's out of our control. So, thank you. Okay, we are moving on now to presentation and possible acceptance of the FY23 second quarter strategic plan results. And Rayona Lavoie going to be coming. Hello, madam.
Hi. Good afternoon, members of the board. My name is Rayona Lavoie, and I'm a management analyst within the Office of the District Health Officer's Office. Today, I'm going to provide a high-level overview of the health districts. Let's go back one, Susie. There we go. Today, I'm going to provide a high-level overview of the health district's progress in relation to the strat plan
during the second quarter. In your board packet, you should have a detailed report, and I'm going to provide you with some context so that you can make sense of all the information that was included. Before we get into the results, I want to give you some background information about how we got here today. Every year, the Health District conducts a strategic plan retreat with the board and staff in November so that we can review and discuss the revisions to the strategic plan. Those revisions are informed by community needs, our fiscal status, as well as our organizational capacity. Following the approval of our strategic plan, our staff create outcomes and initiatives to execute the strategic plan, and we put those outcomes and initiatives into an action plan. That action plan then gets uploaded into our performance management system, and we call that system ClearPoint. The Health District uses ClearPoint as a tool to do two things. One, we use it to measure our progress in executing the strategic plan, and we also use it to inform future decision-making. Now that you have the background on ClearPoint, I'll interpret the information in the quarterly report. In the report, you'll notice that the action plan is set up to cascade from the district goals down to the initiative level. Every outcome and initiative has a task owner, who's the person that delivers or oversees that program. The task owners are really the subject matter experts, and they help us gather all of the information so that we can report out on how we're doing. And we report in two ways. So one, they provide an analysis that's captured in the narrative, and then we also use a color coding system that you see here on the screen, and I'll explain that a little further. And based on their assessment, we use this information to determine how well we're executing our district goals as well as our divisional goals. We use a very simple scoring methodology to interpret our progress based on a point system that you see here. After every outcome has a score of either 0 to 1, we take the average and follow the scoring methodology that you see at the bottom of the slide. For example, if there are two outcomes, one is on target, one is off target, that would say that that goal is being executed or it's in progress at 50%. Now I'm going to highlight how well our staff has been executing their action plan. For the initiatives, which are mainly task-oriented, almost 62% were on target and only about 3% were off target. As for outcomes, which capture the impact that the organization is trying to make, over 65% were on target and about 5% were off target, so making great progress there. And then when you start to look at the bigger picture, you can see that about 70% are being executed, and we have about 4% that are off target, which puts us here successfully achieving almost 70% of our district goals, with 2 quarters left to tackle the remaining 32% that are in progress. So that brings me to next steps, and I would hyphen that to say also lessons learned. Using the performance management system to the extent that our staff are, this has provided some lessons learned about how we want to measure and use the data in our ClearPoint system. When we received the data for quarter 2, it provided some insights about ways to measure our goals. So in front of you, we are reporting quarterly, but during quarter 3, I'm going to come back and provide year-to-date reporting. So we're making those revisions right now. And this will allow us to be able to compare our data year over year so that we can track trends, and then we can also see how well we're executing our plans to also see how well or if we're going to be able to achieve those goals by year end. So like I said, revisions are being made to the ClearPoint system right now. Our staff will then upload all of their information for quarter 3, and then I'll be back here in May to provide you with the results for quarter 3. And with that, I'll answer any questions that you might have.
Any questions? One of the things that I would say too, like not that I found an error, but I think you're even doing a little better than you thought. I found a couple blue dots that aren't blue anymore. And so I say that because this is an ongoing document, growing and breathing. And so the legislation just started, so there's some legislation ones in here that obviously would bring that There's a lot more green and yellow dots on here than you're doing a great job. So this is a great tool for us to use. The one thing I would say, because sometimes we get mass amount of information, but as a board, the one thing that you might want to look on here is make sure you look and we get to help direct this as they go. So if there's anything that you see in our community that's not on here, that's something for us to talk about. Or if there's something in that is happening, and I say that, I'm not saying I see it, I just want our, sometimes we get stuff and we're like, yeah, that's great, go do it, but we have a responsibility too to help guide this. And so if there's anything that you're seeing or feeling or even, something to add to it, please make sure you either let us know or bring it to the board. And so it's worth a look through, but there's a lot of work going on, so thank you. But I have nothing else to add. You guys want an acceptance of this? Do you need that, or are we good? Okay, we can have a motion on this, that'd be great. We have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye. Any opposed? And I believe that passes unanimously. Thank you so much. To remind everybody, I believe it's in November, early November, I'm not mistaken, that we will have our next planning strategic session. And so for those new on the board, that's when we'll revisit it all. And so I'd say by then you might want to really put your teeth into it so you can be like, I have something to add and really feel good about it. Discussion and possible direction regarding legislative issues regarding the 82nd Nevada legislative session. And we have our own Joelle Gutton-Dotson. Come on down. I know you'd rather be in Carson City right now, but you're stuck with us, so. I tell you, you got to give it to her driving in the snow, out there every day, so good job.
Well, hello, board. How are you all doing? It's nice to see you all in person. Is this where you want me to give the update, Kevin? Or do you want, okay. So I'm not super prepared. I apologize for that. But I did want to just run over a handful of bills, and then I figured some of you may have questions on specific bills that I could possibly answer. So our number one priority bill, SB 118, the Public Health Improvement Fund, that has already passed out of work session in Senate Health and Human Services. However, we are still working behind the scenes to look for some sources of sustainable funding. And I'll just leave it there. I'll give you more updates as we progress. But we are getting buy-in and support, so that's great. AB 53 is the Attorney General's tobacco bill. And this is where our tobacco prevention folks, and not just health districts, but a lot of tobacco prevention organizations, we call them the body parts, cancer, lung, and heart associations are very involved. We're trying to take away warnings from tobacco license holders and increase fines, and then also add in suspensions. This bill has become highly contentious or just debated with the Las Vegas Chamber as well as the Retail Association. They don't want suspension or revocation of license. And after looking at our suspension NRS, it looks like it's pretty difficult to suspend licenses. So we're trying to work with something, increase penalties, maybe fix the timeline so that we could actually get from the first fine to the second. Right now, it's almost impossible to get to that second fine. So we're still in negotiations with that. The Attorney General's office is being very gracious and trying to work with everyone and make everyone happy, which hopefully will just make us all slightly unhappy. That's the art of good compromise, I think. SB 92, I think
Hold on one second. As you go, I want to interject on a couple of these. On that particular one, for the board to understand, there's a mental health piece to this that's real important. And so, we do meet weekly to talk about some of this, Vice Chair Reese, myself, and us. And so, we need we do need to continue to push to see something happen. What that needs to be, that can be argued about by people who are in Carson City. That's fine with me. But doing nothing and getting to nowhere, eventually, that will affect us badly as a state. And so I just want to make sure you guys are aware of that.
Yeah, currently Nevada is out of compliance for license holders selling to minors, and that is connected to SAMHSA dollars, and we are above 20%. We're at about 28%. So once you hit above that 20% threshold, there's a chance we could lose up to 10% of our SAMHSA dollars, which is $17 million annually. However, with the new passing of AB 360 from last session, the electronic verification, these past 2 months in 2023, we have been down closer to 11% out of compliance. So Assemblyman Hafen, who passed that bill last session, he's hoping that maybe this takes care of the problem. And right now, it looks like it has made impact, but we're not sure if that'll stick or if it's just new. It's new in everybody's mind, fresh in everybody's mind.
Thank you.
You're welcome. So moving on, SB 92 is the food vendor bill. I'm sure a lot of you are aware of that. All of the cities, counties, health districts, a lot of people, gaming, restaurant association, lots of people are involved in that. That has not made any progress or movement since the hearing several weeks ago. Sounds to me like there's still some negotiations going on with amendments, mostly between the cities. There's a city collaborative working on that. SB 172 was heard what feels like last year, but I think it was just 2 weeks ago. Was a very long hearing, but that bill sponsored by Senator Harris allows minor consent for certain healthcare activities, which is important to us. Now we can test for STIs instead of just treating STIs for minors, as well as with or without Title X funding, we can provide contraceptives. So that was heard in committee. There was a lot of support and there was a lot of opposition. We are strong supporters of that bill, so we'll see where that goes. AB 45 and AB 69, I get confused which one's which. One is the treasurer's bill and one is the Washoe County Regional Behavioral Health Bill that both do loan forgiveness for mental health providers. Those have both been passed out of work session, so that's great. Lots of support. There's several other bills that we're watching and we're involved in. And quite a few bills that we are watching because we have removed ourselves from or trying to get ourselves out of. So those are just things we're watching. I think we're here today to discuss AB 253, which is the cannabis events bill. So that bill was heard last week, I believe. The language was dropped late in the afternoon, and then the bill was heard at 8 a.m. the following morning. And the bill is basically adding to the cannabis lounge bill, adding permissive language to allow events for 21 and over for vendors to sell cannabis in basically separately permitted by the Cannabis Compliance Board of kind of like a segregated area for people to smoke or ingest cannabis at events. So it's same language as last year. The cannabis lounge is permissive for counties and cities to opt in or opt out. It's also 21 and over. And for us, I can't think of one event in Northern Nevada in Washoe County that is just 21 and over. And I'm not sure. There were a lot of questions with this bill. I do know that they are focused on outdoor events, not indoor events. This would be limited to events 5,000 and over. So I think this is largely targeted towards the Life is Beautiful concert in Southern Nevada in Las Vegas. So we were concerned with the bill that we would have to do some permitting for food food or event permitting, we have been told that that would be all through the Cannabis Compliance Lounge. So we have stayed out of it thus far. I think there's still a lot of opposition from law enforcement. They're not comfortable with cannabis and alcohol at the same events, and it's a difficult thing to enforce. So this has become kind of a social equity issue because cannabis lounges are very out of reach for a lot of people. They're very expensive to even put your name in the lottery. So this is the way the bill was presented, kind of an equity issue, giving people who can't afford lounges to partake in the lounge industry an opportunity to vend marijuana. However, they have to buy the marijuana from a dispensary. So then there's some question there about how high those fees would be and if they're prohibitive from even purchasing them. So that's the update on that bill.
Let me speak on that for a second, please. I actually asked for this to come before us. Everyone can have their own opinions on whatever, but things like this, I believe, could potentially affect the health of our whole community. And so if anybody ever needs to or wants to speak into it, I do appreciate the state allowing the cities and counties to make their decisions, opt in, opt out. But the problem, the way we function, though, which is say Spark said yes to this. We're right next to you, and what did we do, and what did we create? And we are the health board. And I am concerned a little bit when it comes to the enforcement of when we say we're going to, I know what my cops can and can't enforce. I know what we don't, I didn't mean to knock you over with my cane, what we can't enforce. And so we say, well, they're only allowed to sell what's from a lounge, but how is that even enforced? So there's so many things for the health of our community at large. I get that there's a city job I have, and I'm trying to just wear my health hat, I promise. I know that was a conversation we had. Is this really a health department question? But I do think there's a responsibility we have at large for the health of our community. And so I only share that out there. Feel free to share if you'd like, or if there's even something private you want someone to know. But I do want to throw this out there. Thank you.
I did want to add one element. We have signed on to a tobacco prevention letter that expressed concern about smoke in the air, so inhalation and things like that. However, Scott Rutledge has informed me that it will be outdoor events, so I know that brings up different issues. But I do think our tobacco prevention arm of the health district is trying to has addressed those pieces that impact health.
Ms. Reese?
Thank you, Mr. Chair. I think, first of all, Ms. Gutman-Dotson, you're doing tremendous work in Carson City. I was in the building this morning for a couple of hours on unrelated matters, but I know that your professional colleagues think very highly of the work that you do, and your reputation is really what we rely upon when you're in that building, because there's so many fast-moving parts. And what I consistently hear in the building is that you are someone who people trust the information you provide, that you are someone who seeks compromise and is advocating for us. So first of all, my thanks. The second thing is more of a comment to my colleagues on the board, and Chair Dare and I maybe disagree on some elements of this, so I will tread lightly because we're close friends, but I want to make sure that we stay in our lane as the health district. I think there are questions in some of the bills that you've discussed so far that maybe to me do not touch on the role that we may have. I'll give you an example. When you start to talk about cannabis events, right? I've read the bill. First of all, the bill is going to be dramatically different in the future than it is when it was presented. But there are questions there that are really about enforcement that are not really health-driven, right? The question of whether or not cannabis is healthy or unhealthy, I think there's lots of debate on both sides of the aisle, but that train has left the station, right? In this state, cannabis is a legal and consumable product at a certain age and with certain conditions in place. So I don't want us to be involved in the middle of those fights, right? To the extent that there are things which code enforcement in cities or police are having to deal with, I'll leave that to the folks at the cities to deal with that. Your focus, of course, I think should be on things like you've described in another bill, which are related to, STIs and the way in which our role in providing the health and the health apparatus is well-defined and articulated. I have another bill that I think would highlight that, but I don't want to surprise you with it, and that has to do with a newly announced bill, which I think is AB, let's see if I took notes, AB 374, which has to do with gender on birth certificates. And again, because this board and will have some relationship to birth certificates, perhaps there is a reason for this board to have an opinion. And again, beyond the scope of what we would talk about here, but I'm using that as an example to articulate a policy choice, which is let us stay in our lane as the District Board of Health. Let us think strongly about the ties to health-related issues. I don't want us to be in the weeds on a lot of things that are distractions from that mission, because ultimately a lot of what goes on in that building is not what happens at the dais. It isn't when you come into the room and sit down and say, you know, for the record, I am insert name and I want to say these things for my 2-minute period. Those are important components of the legislative process, but certainly not determinative of the outcomes. It's those moments where you are in offices, when you are working through subcommittee working groups, when you are working with our colleagues, and believe me, I know and trust you to do that well. I just do not think that we gain much from irritating certain elected officials who maybe we need their help on other bills, or by being so vocal about things which do not touch on health-related concerns, right, or only marginally do so. So, and the chair and I do sit on the sort of the subcommittee, I guess, as it were, that helps to hear from you on a weekly basis. The other members who are here today don't necessarily have that access, and quite frankly, I was missing from the last two for other commitments. But again, I'll leave you with my thought, and the parting thought is I trust what you're doing there. Continue to keep us updated and continue to focus on the mission of this organization almost in a vacuum and to exclusion of other things.
Thank you. Any other board? The one thing that I would, and I think the one question I'm constantly asking is it our lane? So I don't actually even disagree with anything you said, in the sense, I don't know that we always all fall on the same thing, what the lane is. I mean, we can all sit and talk about that. But I do think in the very end, do know this, that we either stand with, against, or neutral on each bill. And then what happens in the very end is there's compromise made, and then whether we put our voice in there or not, whether we get to, you know, whatever, it matters. And so that's the part that I want to do. I never, I don't think any one of us get to come and speak on behalf of everybody on this. And so if there's ever a question, and I say this to any board member, if there's something on the health thing, even if it's something him and I are like, hey, this is what we agree on. We're trying to inform you, but feel free to step up. You have a voice, you have a perspective, and with that said, we'll kind of walk down that together. So, but staying in the lane, I agree, but it's a wrestling lane.
We do have a very wide lane.
Yes.
We really do.
Yeah.
And I just want to extend to any committee member or board member, my phone number's online. It's everywhere. I can answer questions. I can find out things if you have particular interest. With our lane being so wide, we have been thrown into a lot. This session, EHS has mostly taken the beating so far, where we're not necessarily the right authority, but we've kind of just been stuck in place. So there's a lot of that has occupied a lot of my time, just like extracting ourselves from things that aren't our lane. But I have a couple other bills if you want updates. Kevin, did you want to say something?
Well, I just wanted to, and to follow on that, and I appreciate Vice Chair Reese's comments on the importance of what happens that isn't in the committee meeting, and the work that happens with legislative representatives and in their offices. And the Health District does have a wide lane, and because of that, we're often viewed as a Swiss Army knife by people in the legislature, and if they need somebody to do something, then the Health District's probably the right group to do that. And so Joel has a number of wins that we're not going to hear about because we're not in bills, and we're not being tasked with a bunch of new responsibilities because of the work that goes on behind the scenes. So.
I've called those with my most pride. It's the ones we get out of if necessary. But I will tell you a few we're supporting that they're somewhat in our lane. We supported a soil health bill. We've supported an energy bill that it's some sort of federal reimbursement for turning in like high diesel emitting vehicles. So we're supporting that. We just supported a bill around wraparound housing. That's a piece of our CHIP. There is a omnibus tobacco bill that I don't think has a chance of passing as it is. It's banning tobacco, it's banning flavoring, but there are pieces of it that we would really love to see pass. There's $5 million for enforcement and prevention. That's a priority of ours, is to get our vaping prevention dollars back that are never included in the governor's budget. We'd like to fix that eventually, but right now we're just going to look for the $5 million. And there's, the money's there, it's just a matter of getting it, and that's the very last days of session. Trying to think. We were in a barber bill that I don't even think that bill's going to be heard now. The sponsor doesn't think he doesn't really care anymore. But it was taking the barber licensing board and moving it into health. So we've taken care of that.
One of those wins.
Yeah, that was a win. And then there was a bill, there is still a bill, and I think there's some effort to try to make this meaningful, but AB 240, and it's trying to figure out how to enforce medical marijuana plants that are legal but causing odor nuisances. It's largely a Carson City bill, but we were put in as inspectors, and we just kindly said that we do not inspect or have anything to do with marijuana, or do we go to people's homes and inspect anything in their homes. So that's been taken care of as well this week. So there's a large sex ed bill coming, and I imagine it's going to get the same support and opposition as 172. All it's doing is changing opting in to opting out. We know in Washoe County School District and all school districts, opting in has a lot less attendance versus opting out. So it's creating scientific, evidence-based, informed sexual health that we already do to some extent in the county. It's just changing it from opt-in to opt-out. And we have been asked to co-present on that bill. So Jen Howell from CCHS has been a real advocate of ours for those kind of issues. There also is an EMS bill. I don't think we're directly involved, but it's moving the Emergency Management Bureau to the Fire Bureau from DPBH. And I have contacted the governor's office. They're looking into the impacts of that. I've seen some support and opposition on that. We're just kind of paying attention to that bill. That's all. That's about all I have right now.
Thank you. Any other discussion or questions? Yeah, thank you so much. And
you.
we will continue to try to keep everyone updated. But again, if there's ever questions or whatever, your voice is important. So
thank you.
Thank you so much. We're on to our staff reports and program updates. We'll hear from Air Quality Management first, Francisco Vega. Hola, señor, ¿cómo estás?
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. There are a couple things in my report I would like to highlight. First of all, I did provide some information about some new resources that are available to school districts to take advantage of federal funding in transitioning to electric school buses. So we're pretty excited about that. Last fiscal year, the Washoe County School District was not part of the funding. They just didn't qualify. It sounds like in upcoming opportunities they will qualify. So again, we'll work with the school district to make sure that we provide whatever support we can.
If there's any help you need with that, I mean, one of the things is we're not in attainment with air quality. So those of us newer on the board, whatever, may not know that. So anything we can do to push things or help guide things forward, push is a bad word, but guide things forward and give opportunity, I'd love to help.
Absolutely, yeah, we'll definitely look for those opportunities. Secondly, I wanted to provide a highlight of the close of our 2022-2023 burn code season. This burn code season was our, I think, 5th year in a row without a red burn code. So I think that really highlights that our programs, such as our wood burning device program and our stationary source permitting programs, are really doing what they're intended to do, which is, again, protect air quality. So I wanted to highlight that. We did stop a streak of green bird code days. I believe that ended at 124 days. But we did start a new streak, which ended this burn code season at 70 days. So ended one, but we're starting another one. So pretty good success there. And with that, I'd take any questions that the board may have.
Any questions? Okay, wonderful. Thank you so much.
Thank you.
Good job. And now we have Community and Clinical Health Services with Lisa Lotritz.
Lisa Lotritz, Division Director for CCHS, again for the record. Just a couple updates and highlights to my report. Tomorrow is World TB Day, so just wanted to highlight that. And our team is busy working our TB cases, so I was talking on the phone with them, and they're going to be in a symposium all day tomorrow to celebrate that day. And then some good news, we just found out late last week that we are going to be funded for Title X. And that is going to be for the remainder of this project period, which goes through March of 2027. It is not the amount anywhere close to what we need to fund the program, but with the other funding sources we've identified, we are going to be doing great. And the one big thing with this is the minor consent. That was a concern for us. So with the Title X funding, there will not be an issue with that. And then I wanted to highlight COVID vaccines, and I might be able to answer Chair Dare's question. So just one thing recently is Moderna is no longer going to produce the monovalent, or we're not going to receive it, whether or not they're producing it. So as of April, we will no longer be, actually, we are not ordering anymore now. But so what we have, and we will no longer get additional monovalent Moderna for 6 and older. And so we still have Pfizer, and what we're seeing is that it was expiring. So when the expiration date came due, I think they decided not to produce more of that. Pfizer, the expiration date is more into the summer, late summer. We're not, we kind of believe that will probably happen with Pfizer as well, that they will not manufacture more, and it will go to just having that bivalent. You can still get the monovalent for 6 months to 6 through 5 years, and we haven't heard anything on that, but no more Moderna monovalent for 6 and over, and then we do plan, most likely Pfizer will follow with that. And I think what we're hearing is they're trying to harmonize the COVID vaccine, and this is just our speculation, but that it will eventually be a bivalent. And that will be if someone comes in, just like when you get a flu vaccine, you come in, you get your flu vaccine. We're speculating that it will eventually be like that, where you just come in and you get your whatever the most current up-to-date version of the vaccine is what you will get.
Thank you.
Yes, but I will, as I hear more, I will bring that update to the board on a monthly basis.
Appreciate that.
And then lastly, our mobile harvest, our CHUIs, our community health workers, did bring the mobile harvest truck to the county complex in March. And thank you, Dr. Novak, for helping as a volunteer out there. They appreciated it, and they look forward to that continuing. And that is, we needed to see 50 participants, and we had 53 for our first month. So that will hopefully be a monthly ongoing activity, and they're going to be back the first week of April. Yes, and that's all I have, but I'm happy to answer any questions. I was just looking it up. It's the first Tuesday, I believe. So I think it's April 4th. Yes. Okay. Yeah.
Any other questions? Thank you so much.
Thank you.
We are now on to environmental health services with Aaron Dixon.
Good afternoon. For the record, Aaron Dixon, Environmental Health Services. You have my report in front of you, but there's a few things I'd like to highlight. The program highlight this month is our admin team. This is a team that doesn't get a whole lot of credit for the amazing work that they do. There's a total of 7 staff, and they are responsible for all front and back office activities for all programs. I could give you a laundry list of everything that they are responsible for. Highlights are billing, invoicing, they schedule, they are the experts in Acela, which is a very difficult program to be an expert in, but they have to be an expert both on the customer side and the staff side, as they will help customers. They will walk them through how to log into Acela, all those different types of things. They are also our first line of customer service, both the good and the bad. Last year, they responded to an average of 476 public records requests each month. So it's a huge lift just in that one area. Those that sit at the front counter, also we have an individual who provides services in, can answer questions bilingually as well, which is a very important component. And they are a key component of the Environmental Health Services Division, and they deserve significantly more recognition than this short report does provide. I do want to highlight that there is new data in the report. There is a chart that focuses on openings and change of ownerships. I know when you're sitting at home watching the news and you hear, oh, this restaurant is going out of business or this one is starting up. We have never pulled that out and highlighted it. We are trying to see if we can tell data in a different story. Those inspections do take significantly more time. Our team is making sure that new business owner has the infrastructure to be able to match what the activities they're going to be doing and to be successful in the future as well. And so there were 94 opening inspections so far in January and February. And finally, in Vector, I want to highlight something that's not in the report, but is going to be a major change to our program. The individual we have contracted with to do the helicopter treatments for longer than any of us can actually remember, we think is probably somewhere of 30 or 40 years, it's been a long time, is retiring. Yes. So he also provides services into a lot of the jurisdictions surrounding Washoe County, and to many in California. So what we are going to be doing, we're in the process of looking at drones. Drones really have been the up and coming treatment choice by many communities. They can really target some areas that the helicopter couldn't get to, especially as our community grows and those treatment areas get smaller. They're not less important to treat, they're just harder to treat with the helicopter. I believe this is the direction we would be going. It's just we're accelerating how fast we're getting there when it comes to the drone. As for our treatment calendar, we would normally do a treatment in early May. Well, that's not true. Based on weather, we would potentially do a treatment in early May. With the drones, we won't have the capabilities to do that. Our team is confident that as things are looking, that we will be okay. We'll be able to do a treatment. It will be a little delayed. However, if it hits 90 degrees for a week in April, it's going to be a little different. But just know that the team is on top of this. They are doing as much rapid research as they possibly can and are working forward to have a positive outcome.
So I have a couple questions on
Absolutely.
that. One is, that's kind of exciting we're moving forward.
Absolutely.
I'm wondering about the budget on that, if there's finances needed. Secondarily, if that kind of thing does hit, do we have any other way to go out and deal with Vector so we're not just like, well, we're just stuck. The guy retired. That doesn't seem like the final answer in my brain.
No. So we do have the budget for the drone at this point with a combination of the helicopter contract and then some other few line items that we can rearrange. We have reached out to other companies and gotten quotes on, if we need you, can you come in for a day? They are incredibly expensive. I haven't seen the quote, but what I've heard is upwards of the $35,000 for the day. But there are those that can provide that service if necessary.
Thank you. Any other questions? Thank you so much.
Thank you.
Appreciate it. And now we're on to Dr. Nancy Dow, Epidemiology and Public Health Preparedness.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report, nothing to change from that, but I do want to just note some of the work that we've been doing in epidemiology for connecting the remaining of our COVID investigation staff with other disease investigations to just maximize our programmatic needs. So the remaining ELC COVID-19 enhancing detection expansion funding was permitted at a federal level to be able to be utilized for other infectious disease areas of concern. So with that, efforts are underway to provide training and shadowing for COVID-19 disease investigation staff to help the program epidemiologists in investigating high-frequency reported conditions, which includes providing guidance for post-exposure prophylaxis when there's animal bite, and investigating enteric conditions such as Salmonella, Campylobacter, Shigella, Giardia, etc. So this, in turn, will also help us increase some of our capacity in our epidemiologists to dedicate times to these time-sensitive disease reports that we need to respond to instantly, and also increase programmatic outputs in some technical aspects, such as epi-analysis, and increasing our production of epi-news to the community, and then reviewing and updating disease chapters in our communicable disease manual, which is the backbone that we reference for our investigations. So that's all my updates. I'm happy to answer any questions you may have.
Thank you so much. Any questions? Well, thank you so much for your update.
Thank you.
I appreciate it. On to our District Health Officer, Kevin Dick.
Thank you, Chairman Dare. I just have one update under our Health District Communications, and that is that we have been selected as a Golden Post finalist by the Government Social Media Conference that's going to be meeting in Reno in May. And it's in their Facebook category, and it's for the work that Yara Diavola's done with the Spanish language Facebook site that we have. And so it's an honor just to be selected as a finalist. We are the only health department across all of their categories that is in the running. Although in a couple of other categories, they do have the U.S. FDA and National Institutes of Health. So there's some big organizations. I think we're punching a little above our weight, and we'll find out in May is when the conference is held. And so keep your fingers crossed that we're the winner.
Can we send a picture to the other health districts around the state? Just kidding. Just kidding out there. Yay, good job. That's fantastic. Any questions for Kevin? Very good. We're moving on to our board comments, if there is any. Announcements, reports, updates, anything? Yes, sir.
I do want to point out, not only are we a finalist for this, I was in D.C. for the Hill Day for NACCHO and for NALBO, and it was brought up in the big main NACCHO meeting that Washoe County District Health has won the food award last year, and how important that was, that they want to be able to focus on us and what we've done and how we've done it and pass it back down through all their whole membership. But there is only one food award. Was it every 2 years?
It's annually, but it's not awarded necessarily each year.
Yeah, so we are well recognized for doing it. Where's Washoe County? Right here.
That's good.
Right in front of you, so. No, but I want to do that. Had a very good meeting for Hill Day. Spent some great time in Representative Amadei's office with our new contact person in John Quinn, who has really hit the ground running. He's done a lot for us already on his own, kind of on his own time too. Had a great visit with Catherine Cortez Masto's office. They've got a new person there that has well versed in it. And even in the middle of our meeting, the senator came in and said, I got a couple questions. So we do have a great relationship. Nikki Akers from Carson City and I, this is our 5th year. We've done the Hill Day. So they now recognize who we are, so which is important.
Oh, thank you for going. Very good. Very good. The only thing I just want to remind you, on April 7th, Friday morning, we hope to see you at 8 o'clock. So any staff out there and any of us can make it. So with that, we are adjourned.